Alright, good evening everyone. So, I'm planning to start a new venture which is quite interesting in its own fashion. Without wasting any time, let's just get into the pitch deck. This is my practice. I'll be practicing it a couple of times because I'm looking for seed funding for this application. I had other plans earlier where I was supposed to gather all the money that I developed, like came up with my portfolio working with different clients. But after a couple of sessions where I was like cost questioning everything, not cross but cost, cost questioning everything. So I thought like a little seed money would help. So there's a little part of my presentation which I can actually show. Other than that, no, I can't. So let's get right into it. So what is intuitive AI? It is bridging the gap between AI driven accessibility and clinical grade mental health care. We have the problem, the solution, how it works, market opportunity, obviously, and the technology. So, the problem, the care gap. Statistics one is it's like 1 in 4 people suffer from mental health issues, but wait times for specialist average 21 plus days. So, what these people are doing, like waiting for their adulthood to begin, and after that they get into the conversation of mental health, which is kind of not something a person should do, because if you're feeling a certain way you should possibly, like, as soon as possible you should have to go to either the psychiatrist or the psychologist, because if this doesn't work the whole body won't work. Simple as that. What's the critical failure here? That most current AI therapy apps are too shallow for severe disorders, while traditional therapy is too expensive in India, and it is also inaccessible in daily crises. The pain point of public here is people with several severe conditions often feel abandoned between weekly sessions. What actually happens is like your therapist is gonna take your session, and after that you need someone to talk to who will be understanding what you're saying. There comes our AI model, which is fine tuned to only react to mental health questions and answers. That's it. It's a model that we, like, currently I, earlier it was we. So I am fine tuning a model where this particular chatbot and also the speech to speech calling feature will be available right there. So for example, like you get a panic attack, you jolt, and you wake up suddenly, like at the odd hours of the day, somewhere around like 3 or so, you'll have a companion with you, completely human. You have already seen how ChatGPT works, right? So completely human. Nothing is like too forced towards AI. Although it's difficult because, for example, you call a banking app for a banking this thing nowadays, make a call, and just see how badly they have integrated the AI model, which speaks to you and is unable to understand what kind of service you're looking for. And this is like before you want to speak to a customer service executive. So you're solving that problem as well. So solution, intuitive. So the hybrid model, a dual support system, weavable relatable stories into your presentation using narratives that make your message model. So I think we need to remove this one. So app is actually a hybrid version. I'm sorry, that was a chat GPT glitch right there. So layer one, what does it do? 24/7 fine-tuned AI companion for immediate distress management. 24/7, anytime. The layer 2 is seamless escalation to licensed human psychologists. Now, what happens is, like, if someone wants to visit a psychologist in person, we help them in finding and extracting the ones that are really good, and also cutting the costs in between. So we are not a middleman, but we create a profile of a patient, and after that, when I see that who will be the right fit, so like I have seven psychologists on my board. So I'll send this person to one of them. Now what happens is, with projects like this, what you have to do is you have to create a human personas. For example, let's take Anandya. All right, he is suffering from severe anxiety and depression, clinical depression. So what happens is, like, after my session with that particular therapist, it doesn't just end there. All right, so you can pull out a phone. We'll give you the app and the website, whatever it is your 24/7 companion. It's gonna listen to you and even respond to you, and that is the crazy part about the app. And right now, I'm currently building it completely solo. So let's see how it goes. Now, what is the value proposition? Real time support, I just talked about, that knows when to hand over the reins to a human. So you'll be able to reach the psychologist, but well, you have to take care of the fact that these psychologists are working at multiple places in a day. So they're gonna give you a very limited time, like an hour or so. What after that? If you still feel like talking about after that, we use the app. Then I don't know, I was just making this PPT. It's been a very long time. Alright, yeah, I have to complete this, but I was trying to practice. Right now, I'm like a bit glitchy, but I will just finish this whole PowerPoint presentations and stand up with this and show you one by one, like from here, how everything works. So I'm working on this right now, and this is an idea that came like to me around January last year. I was going through something, and I spent like lakhs and lakhs of rupees uh, to get treated, but somehow I still caught up in the same thing, and you know, I now better know than a therapist how to treat people, because I have been doing it simultaneously for a couple of years. Uh, the only problem that I am dealing with is anxiety, which has lessened down a lot, but it is still there, and sometimes it takes over me, and then I'm like, I don't know, I don't have an answer for that. So yeah, this is the presentation, and I have a meeting with a certain venture capital fund, but I'm not gonna name anyone here. It's just not safe, and I'm gonna pitch them this intuitive app, and the amount I'm looking for is like $2 million, which is 20 lakh rupees in INR, somewhat close around 21, 22 with the exchange rates right now. So I need 20 lakh pump in, because I'm not gonna hire like a team of professionals who do nothing. Like, I will go for two programmers who are working with me day and night. That is the approach, and it's the lean approach. Uh, I'll take out a demo version and send it to all the psychologists and all the people, get feedback from there, and then um, and after that, I think yeah, and after that we'll just keep iterating, 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 until we reach the final model, the final product, and that will be out on February next year or March next year. Depends on how many people we get on board as advanced users of us through the demo. But this project is very enticing and very exciting. Finally, someone, even if it's me, is providing value prop to the crisis which has like completely overtook us. I mean, the Gen Z and the millennials, everyone are having like, you know, not everyone, but the majority chunk of everyone needs mental health solutions. And yeah, life is rough. 15 years ago, if I spoke to anyone about this, they would just make fun of me. They will just call me mad, lunatic, or anything. There's no shame if you are. See, an illness is an illness. Let it be a mental illness or something else like a terminal illness. It's an illness and it can be cured. But sometimes what you have to do it, you have to join hands with people who are already working in the sector and build something which would help mass media. So this is my plan, and after that, once this whole thing is done, I'll practice because my meeting has like what, today is 12th. No, it's 26th. Sorry, what happened to this time structure here? Anyways, so I'll be meeting these people on 4th of January, and let's see how it goes. I think I can make this work. I'll be, and this $2 million is not a lot, just a seed money, and just to begin with, because I need to hire like 2 to 3 developers, and buy subscriptions and stuff like that. Go to a co-working space where three of us are like wired in and constantly coding. So I need the money for that, and that is I'm gonna raise, and hopefully I'll be able to raise it because from this very same investor, when I did Dexa, the NFT ticketing platform, he wrote me a check. So I think the problem here that what I'm trying to solve will get me at least a startup seed. Everyone needs it. I need it. I'm not putting any pressure on my father now anymore because he's not in the service. He's a dad. So where do I get the money from? From angel investors. So I'm really sorry that I have mentioned venture capitalists. They're all the same. What differs is the amount of check that you write to. So an angel investor can help you with like 200K to $5 million, and after that the VCs come in. So that's it. I think I should finish this presentation. I'm also not liking the design of it, so I think I'm gonna design something of my own, very interesting, and I'll be back by tomorrow evening where I'll be showing you the whole trajectory of how this market opportunity is, how we as a team, like me and my developers and a person that I need for marketing, like being lean as a service provider can help people, and that too in a very mass manner. So yeah, that is it. I think now let me just finish this off, and I'm ready to go. I'm pretty excited, fingers crossed, because this time he's not alone, and there'll be another investor accompanying him. So let's see, and yeah, let me just finish it. So see ya.